Welcome to Adventures in Surgical Weight Loss with Dr. R. I'm Dr. Richard Rasmussen. I'm a bariatric surgeon and excited to bring you another story from a surgical weight loss patient. My goal is to give patients a place where they can share their amazing stories. I get to hear these stories all the time. I hope through this process to get rid of some of the bad information that exists about surgical weight loss. Welcome back. Today, we get to hear from Paige Schanze. Paige is almost a year out. She's just a few weeks away from being a year out from a gastric sleeve. She's done really well, lost almost 130 pounds total. And one of the things I really loved from the interview with Paige is she spent some time, quite a bit of time, talking about what you need to do ahead of time and getting into the right headspace and being ready for these changes. And I really appreciated her perspective on that. I think you will enjoy it as well. Today, I have the opportunity to sit down with Paige Schanze. Welcome, Paige.
Thank you.
Why don't you just jump in and tell us your story?
Okay, yeah, for sure. I struggled with weight for a really long time. I started gaining weight around the time that I was like 12 or so. I had kind of a traumatic life event that happened that kind of started me on the journey, and it didn't help that I also had family history of obesity on both sides. Several uncles and aunts who on both sides were heavier and had struggled with their own weight loss and stuff. And so I really just it kind of compounded between the trauma and then family genetics and all of that just kind of like spearballed me into gaining weight. And then I stayed, through my teen and young adult years, I stayed pretty consistently, like, lower 200s. And, nobody ever really, I always got such funny comments because it was like when I would tell people my weight, because I've never been ashamed to tell people like how much I weighed. Unlike some people, they're like, oh, I don't want to tell you. That's rude to say it or whatever. Um, Everybody was always like, really? You don't look like you carry it so well. And I'm just like, okay, well, it doesn't feel like it, but sure, whatever. um, and I I have 3 kids, and, when kind of after each pregnancy, um, it was odd because like, I would always lose weight during the pregnancies because like, I guess that's common for, women who are overweight to begin with. When they get pregnant, they lose weight because it's going to the baby, but then after baby, it's like you gain that plus more back. And I usually gained about 30 pounds after each pregnancy again, and then any time in between, I would gain more weight. And, um, in the end, I ended up being like at my heaviest, I was about 350 pounds. Um, and I, about almost 4 years ago now, I started talking to my doctor about trying to come up with methods to lose weight. Initially, even in that initial appointment, they had talked about um, surgery as an option. And I was skeptical because I grew up with the belief that it was the easy way out of what to get surgery or liposuction or any of those things. Like it was like, no, that's not the way to do it. And um, I was like, well, I just really want to try, like, can I just try it on my own? Like, can I try to do things on my own? And I even rejected everything from there's the shots and the pills. Like, I just wanted to try everything initially to try to see what I could do on my own. Um, and I, I don't know why I bucked against it so much though, because it's like since the time that I was 12, like my mom and she had us join Weight Watchers right around the time that I started gaining weight. And then we would try my mom's kind of one of those that does all the fad diet stuff, so she kind of tries all the different things. And um she always takes them to the extreme though. So it was like we tried like a cleanse once, and I remember like it was like 7th grade, I think, and she had packed me like this cleanse drink for lunch, and that was what I was only supposed to have for lunch, and it was like this broth made from Mrs. Dash, and it was horrible tasting.
Oh
And, like, I was
no.
so mad that that was what I had to eat or and I was just like, looking back on it now, it kinda makes me laugh because 'cause I'm just like, this is that wasn't the healthy way to do things, and it kinda set me up for, just a really bad idea of, like, what dieting and taking care of yourself was. And so I, kind of rejected after leaving the house and getting married, I kind of rejected all of that, and just was like, I'll deal with it at some point. I'll, whatever. Um, Finally, after, um, starting to talk to my doctor and then getting a new doctor, shortly after that, she finally suggested, she's like, "You know what?" Because we kind of were discussing things, and she's like, "Let's take care of let's start focusing on your mental health first, and then we'll worry about the weight loss. Like, the weight loss will come. We can like you're y I was really lucky because I didn't have, I'm almost 35, and being overweight for so long, I don't have any health issues from it. Like, I'm really fortunate that I don't have high blood pressure, high cholesterol. Like, I was really healthy internally, but, um muscular skeletal issues were happening. Like, my lower back was hurting all the time. I'm a hairstylist by trade, so, like, standing on my feet all the time with carrying that much excess weight was really bad on my joints, my knees, my ankles. Um, and I was just kind of, like, really starting to feel like I needed to make a major change. And so I started going through, um, therapy and really working with a counselor. Um, and it was kind of coupled with like, okay, I eventually want this to help me with weight loss, but I know that some of the underlying issues are due to that trauma I experienced as a preteen. So let's face that, deal with that, and learn how to cope with that. So that way I feel essentially worthy of the weight loss because I had almost convinced myself that I wasn't worthy of it. Like, I needed to maintain this facade of what I had programmed myself to believe I needed. And so, um, I started therapy, and then with that, I kind of, um, became a little bit more open to the idea of trying a few different options. And so, um, my doctor put me on, phentermine for 3 months to try and kickstart my metabolism. It helped, and I was losing weight on that, but they only allow you to be on it for a certain amount of time because um, it was originally designed as an ADHD medication, which it's funny because I actually ended up finding out that I have ADHD because I was on that. And so that's another story, but it was like I had to go through that process too of a lot of discoveries in the last 4 years. Um, but I after that and getting that taken care of and really kind of working with my counselor, I, um, started to become a little bit more open to the idea and wanting to do more research about the surgery because my doctors kept mentioning it in my appointments. They were like, they maybe just think about it. Like, this is something that it's, worthwhile to even consider. And it was something that I was just like, okay, well, finally, I was just like, okay, maybe I can look into it and see what it is. And so I started talking a little bit more about my doctors or to my doctors about it. And um, then I called, your guys's clinic to get on the wait list because with my insurance, there's a bit of a wait list, and took the seminar online, and it was really that was kind of like the thing that was like, "Okay, maybe this is something that I actually need to do." Like, this is something that I feel is really, like it it also helped that, like, with talking to my doctors, I kind of learned more about what causes obesity in the first place, and like kind of started to change how my brain thought about it to begin with. Cause like, you know, you when I was growing up, like, it was like, "Oh, you're lazy, you just eat too much," and I never actually ate a lot, like, I could definitely eat way less than I ever did before, but, like, I wasn't, like, one of those people that went back for, like, thirds and fourths of a meal, like, I was really, like, and I loved healthy food, like, I would eat a salad, like, all the time, like, it was one of my favorite meals was to eat a salad, and so it wasn't like I was eating unhealthy, um like, terribly unhealthy beforehand, it was just my body genetics wouldn't allow that weight to come off, and I think that's something that, um, I am grateful that is kind of being understood now, is that there's kind of that genetic link that, like, some people just don't their body is like, you might lose some weight, but then all of a sudden your body kind of freaks out and is like, "Oh my gosh, we have to hold on to this. We can't let go. Like something's wrong. Like we have to hold on to all this insulation." And it's not even something that you need. And so uh it was really interesting to kind of go through that process of relearning how to think about weight and what it is. And
So if you were to kind of summarize that now, what's your perspective on weight and what it is now?
for me, it's for the most part, I think that it comes down to genetics. Like what some people like I remember looking at friends even in like high school and even now that they can eat 10 times more than I do and they don't gain a pound. Like I'm like, where does it go? And like you hear the joke all the time, and I've made the joke before, especially before surgery, that I was like, "Oh, I can stare at a slice of cake and I gain 10 pounds." You know what I mean? Like I just can look at it and
Yes,
smell
yes.
it. And so I really think that some people are just more prone to holding on to weight genetically, um, than other people. And for those of us who are that way, it's harder for us to use common methods without extra help. Like we have to have the tools to help us get the weight off. Like we can't just Weight Watchers is a great program. I have nothing against it. But it didn't work for me. It was way too easy to, oh, well, we have this certain amount of points. So if I eat this one thing, it's gonna take up most of my points, but I can still eat it. Wasn't like, like it wasn't the control, like not control, but it wasn't something able to stick to as easily as mm, I some other.
Yeah. I think you bring up a few great points in all of this. Genetics plays a big piece. And
Mhm.
one of the things we're seeing um, is that with poor food choices, there are some individuals who may not be heavy from a scale standpoint, but if you look at them metabolically, they're still very sick metabolically with heart disease,
Sure.
type 2 diabetes, um, high cholesterol, all those types of things, even with a normal weight or just slightly overweight. And again, that plays back into the genetics part. So, very, very key points. The other point that you brought up, I think is key, is that you mentioned, Weight Watchers, for example, didn't work for you, but there's some people it works really well for.
Mhm.
And I think that's true with really all weight loss options. Is there's not one magic bullet. There's not one thing that works great for everybody.
For sure, yeah.
And so, part of this journey is figuring out what works for each individual. And then for some individuals, just one thing won't work. In other words, they may have surgery, but also need some medication or also need Weight
Right.
Watchers or, add some of those other things in as well.
Right. Because I know I feel like Weight Watchers is great for people who, for one, and maybe it's because I do have ADHD, but having to track everything like that was a struggle for me. And so I think like um it works great for people who have that more organized mindset in their brain, to be able to like systematically do those kinds of things. And I agree, like there isn't really a one size fits all treatment for weight loss. And even people like I've heard throughout like my process of getting ready for surgery, being on the wait list, even after surgery, oh, yeah, I had so and so in my family or a friend who had the surgery and they gained all their weight back. And I'm like, I mean, oh, that's terrible. That's awful. I'm sorry, but like maybe they just I think like one of the biggest things that I remember from the seminar for your guys' organization was that it's a tool and you have to use the tool appropriately. And if you don't use the tool appropriately, then it's not going to work for you. And it's not going to be, you're not going to have as much success as maybe somebody else will. And I think that's something that people need to understand too is that, again, it's not a magic button that's gonna like, oh, you have, whichever surgery you have. I had the gastric sleeve, and after talking to my surgeon, that was the one that we decided would work the best for me since I didn't have any other underlying health conditions and I was healthy, other than being overweight. And so he said that we decided that that would be the best, less invasive option because all surgeries have their risks. So you have to weigh which one is going to be the least riskful for you and the most effective for you. And I did a lot of research too. I did a lot of like, okay, for myself outside of talking to the surgeon and the nurse and everything, like which one do I feel like is going to be the most beneficial for me? And I came down to that the sleeve was gonna be it for me, and um, I really think that it's not only important to, like and by research, I mean not just talking to people because people sometimes, like, will scare you out of things. Like, there's all the support groups online, which are wonderful, and I love them. But at the same time, sometimes they're, like, very cynical and very skeptical and, "Oh, this didn't work for me. I had to have a different surgery afterwards." And it's like, you just you have to kind of ignore some of those things. And even other people who have had the surgery in the past, I've had a lot of coworkers who I didn't even know had had the surgery that were like, yeah, I had the surgery, however many years ago. And, you know, so you get good and bad reviews, there's a lot of things, but I think
Yes.
doing your best to, take that with a grain of salt because
Mhm.
like you had said, everybody is so different. Like our body chemistries are different. Even with genetics, like you are um even like I feel like even with families, like someone will be successful with the surgery, whereas someone else in the family may not. And it could be any number of things that causes that. But like it everybody's body chemistry is so different. So you do have to kind of find the things that work for you. And
Yes.
surgery isn't always an option for everybody, but it's a good tool to use for those who um, are are ready and willing to do it and put in the work for it.
Yeah. I want to highlight a couple of things you've said. One, the operation being a tool. Um,
Hmm.
Back to the discussion of genetics. One of the things or one of kind of maybe a simplistic way to kind of describe it is, um, your genetic profile doesn't allow you to tolerate carbohydrates or simple carbohydrates, sugary carbohydrates, right? Your joke of, you smell the cake and you gain weight. I mean, it's just, this is how your body processes those things.
Hmm.
And so, and that's a common theme through obesity. And so with surgery, there's a couple of things that happen. One is it makes your stomach smaller, so you're not able to eat as much, so that decreases the total amount of calories. But
Right.
even though you decrease calories, if you consumed completely simple carbohydrates, then you're going to be pushing your insulin up all the time. And so
Hmm.
that's going to inhibit your weight loss or cause weight regain. And so um, it's not always the case, but a lot of times when you have somebody who's had surgery and then they regain all that weight, if you talk to them in depth, their dietary habits have reverted back to processed foods to foods that are high in sugars that really overcome the ability of that tool to work for them.
Right, yeah. And that's usually what the case I found. Like I kind of like and I never really like asked people that talked about that what if that was the case, but like just kind of especially with coworkers, I could kind of visually see like what they were consuming,
Hmm.
because we're working together,
Yep.
taking lunch and breaks together. And I was like, well, there might be a reason why it wasn't as successful for you. And like I think that you do have to really like you have to think of it real I always go back to the fact that it's a tool because that just really stood out to me because it was like and maybe it makes sense because I'm a hairstylist and it's like you choose the right tool for the right job and um you have to be willing to make a change. Like you can't just expect it to I mean, yes, you're gonna lose weight because your stomach is smaller initially. But if you're not using that tool appropriately and making sure that you're still sticking with things, and it's not easy. It's not like you have to really make that mindset to be like, okay, I'm going to make sure that I'm eating enough protein. I'm going to make sure that I'm adding, some veggies into my diet, high fiber veggies and things like that. Like you have to be making those conscious choices every time that you go to make a meal. Um, and really being unafraid to say no, because like, I think the biggest test for me was when I started going to, like, staff trainings where they would have food or, like, parties with friends and family, like, really being able to, like, "No, I'm not gonna eat that." Like, I'm not and not being afraid to say, "Oh," worried about whether or not you're gonna offend somebody who made it or any of those things, and I think also too, like, when I was working with the dietitian pre-surgery, one of the biggest things that kinda stuck out to me with her was that she said, "It's okay every once in a while to give yourself that little treat. Just downsize the size of what you had. Don't deprive yourself because that's where I think a lot of us that have struggled with weight most of our lives, when we try those deprivation diets where we're, like, either fasting or trying to completely cut something out, that's where we fail because then we get and I maybe I'm just speaking from my own experience, but then I would eat that one cookie and I would be like, "Oh, I should just give up everything." Like, I just totally, like, I just ruined my whole diet, And then I would fall off and just go back to my old habits. And so, kinda just tweaking again your mindset of it's okay if you have that one little cookie every once in a while, as long as the rest of the time you're making sure that you eat the right things and making sure that you're doing what takes care of your body.
Yeah, that's an excellent point, and you know, it's easy. Well, easy. It's easier to say no to something if you think, "Oh, I can have that next time or at a different time,"
Right.
rather than "I can never have that again." It's the never have that again that makes you want it even more.
Yeah. And, like, there were some things, like, that I initially gave up that I still haven't gone back to. Like, um when I started with the dietitian, she had mentioned that like, my very first appointment with her, she was like, "Before you have surgery, they're gonna want you to stop drinking carbonation and coffee and caffeine." Like, and I mean, I was one of those that went to Maverick, got the massive cup, like, once a day at least, sometimes twice a day, like, I was bad with the pop, and so I, May of last year with my first appointment with her, I gave myself like a weekend and then I stopped drinking caffeine and carbonation and I haven't gone back to the carbonation. Like, uh, a part of it is a little bit of fear for myself. I'm like, it's going to hurt my stomach if I drink anything like that. I'm like, I don't want to even go there. But also, I'm just like, I know if I even go back to that at all, I'm going to go start slipping into that bad habit again. And so, for me, that was one of those one things that I was just like, I can give this up. It's not good for me. I can live without it. It's not something that's really necessary for me. And once I set my mind to that, it actually became really easy to say no to it and to not need it. And there's other options that taste just as good that I can drink that aren't as high in sugar or um, don't have that fizziness. And it's like every once in a while I miss like the fizz, but I just get it out of my head and I'm like, it's okay. We don't need it. It's fine. Um,
That's a fantastic or an amazing comment about the soda aspect because number one, congrats on just kind of cold turkey. That's
thanks.
awesome. The other aspect of that I want to point out is if you look at observational data, so you can't necessarily say this caused this, but if you look at observational data, soda is probably the number one component in obesity. And it doesn't even have to be sugared soda. There's plenty of observational studies showing that people who drink diet soda weigh more than those who don't drink soda. And so, the
Mhm.
why, we may not have great answers to the why, but that's one of those things, as you said, we don't need it. There's nothing that it's filling for it for us. As surgeons, one of the things we talk about, and whether this happens or not, I don't know, there's no way we can prove it, but one of the concerns is that gaseous distension could distend the stomach or the pouch up and
Right.
increase your capacity. So that's one of the concerns as well. That we talk about. Again, we can't prove it, but that's a concern. And like yourself, individuals who get rid of soda and just kind of leave it do the best. And one of the things in patients who tend to regain weight, soda is often a common denominator in that as well. So,
Right. Yeah, and I've seen that again from coworkers that I've seen that said, yeah, they gained either some or all of their weight back because it was they had gone back to some of their old habits as far as food. And I think another thing that we have to kind of come to terms with when it comes to those of us who struggle with weight is that it is a form of an addiction. It is food, our relationship with food and how our brain chemistry reacts to food and certain types of food. There is an addictive element to it. And you have to be careful and aware of those triggers for you and like, I use food like many people as a comfort and as but it wasn't just it came to the point that it wasn't just a comfort thing for me. It was when I was bored, when I was just sitting around watching TV, when I was just, whatever, I would always have something. And it was like whether it was a sugary snack or a salty snack or a soda pop, it was like I always had to have something. And so just kind of like changing like initially before surgery, going through the process to kind of get to the point of surgery, I just had to change like what those things were rather than like turning to the sugary snacks or the high sodium snacks like and drinking water and you know um even if you need to add some of the crystal light sometimes to the water to give it a little bit more flavor so you're not just drinking straight water. Like I know a lot of people they don't like drinking water because it doesn't have any flavor. And um so there are options to flavor your water without adding too much to it. Um Even just adding some cucumber slices to the water or lemon wedges or something to it to give it a little bit more flavor is always a good option. And I just think, making sure that you're still getting that satisfaction of having like a crunch from a chip, but instead of a chip, you're having like carrot sticks or celery or fresh broccoli or something along those lines instead. And so, like, because for me at least, it wasn't necessarily what the snacks were, it was like texture and consistency and like sensation of those snacks. So like I needed to find things that kind of satisfied like those kinds of needs in my addiction and what I was facing with my relationship with food.
I should. Um, so you mentioned, it took you a while to kind of to think to get to the point of deciding to do surgery. you've carried us through some of that journey and kind of the mental work you did. I do want
Mhm.
to point that out because um, being in the correct headspace to start this is so, so important. So congrats on taking those steps and getting yourself there. When we talk about the surgery itself and maybe some of the post-op, what was the hardest part of that for you?
I think the hard honestly, the hardest part for me was I had to do the 3-week liquid diet beforehand just because after doing my blood work and everything, like, my liver needed to shrink down quite a bit, and so I needed to do a full 3 weeks rather than 2 weeks, and so that honestly was the hardest part for me after surgery. Because once you kind of have that I feel like that pre-surgery diet change kind of helps set you up for the diet after surgery. Because a lot of people complain about that too and how that was so hard, where you do like the 2 to 3 weeks of liquid diet and then you move to soft foods and all that stuff. For me, already having been on that liquid diet, the 3 weeks beforehand really, really helped me because even though it sucked those first few days and then it was like, okay, I'm just in the routine now. Let's just do it. We're getting to surgery. It's going to be a good thing. This is a short-lived time, like, we're gonna get through this, and then we can go back to eating solid foods, and I had to kind of constantly remind myself of that between both the, um, pre-op diet and then the post-op diets that you're on, and really just making sure that, like, I reminded myself constantly, like, if I was craving something in particular that I wasn't able to have just yet, I'd be like, I'll have it soon. I can have it soon. Kind of like you had mentioned with the sweet treat, like I'm
Yes.
gonna say no this time, but I'll have it next time. Um, it was kind of similar for me with that. It was like, I need to stick to this so that way I can have it in the future. Like if I know that right now I'm in my soft foods, I can't have steak yet. I need to wait. I'll be able to have that soon though. Like it's coming. This short amount of time where I'm on this super restrictive portion of my diet is going to it's not going to last forever. And I think that's something important that people need to kind of also keep in mind when they're going through that part of this transition is it's not going to last forever. You're going to be able to have the foods like maybe not all the foods you used to love, but you're going to be able to have some of those foods you used to love. Like I actually found myself craving vegetables so bad, and you can't have any vegetables for a really long time. And I was like, I want a salad, I want fresh vegetables, and I can't have them yet. And it was just I that kind of makes me giggle because I'm just like, this was something that I really was starting to crave and I wasn't allowed to have it yet. And um but I knew that eventually I would. And for me, one of my big motivations for having the surgery was that I wanted to be around for my kids. Like I have, like, as I mentioned, I have 3 kids. I didn't want to start having internal health issues because of my weight and because of my eating habits and not taking care of myself. And my youngest is
Mhm.
6 right now. And I felt bad that I wasn't able to like really play with her and like run around very much with her or be as active with her as I would like to be because I was overweight and I would get tired so fast. And so, um, during that process of kind of prep it right before surgery and then after surgery, post op, I just kept reminding myself, I'm like, if you eat that, there's a potential that something could go wrong and you're going to hurt yourself. And then that kind of just defeats the purpose of what we've been trying to do this whole time. And so I think another thing that people need to keep in mind as they're going through this journey is just what are your whys and make sure that you remind yourself of them. And if that's something that you have, like, however you need to do that, have little sticky notes or reminders in your phone, anything like that, just make sure that you have those so that way you can always keep in the forefront what it is you
Um,
are doing this for. And whether that's completely 100% for yourself or it's for somebody else, just keep that in your head. And I think um, it wasn't just for, I mean, it initially I was like, okay, this is for my kids, but also it kind of became like, this is also for me. Like there's things that I want to do that because I'm so heavy, I can't do right now. And, or I don't feel comfortable doing. And so I want to be able to do those things that I've always dreamed about or always like had that daydream that, oh, one day I'll be able to do it. And, um,
So we label
feel,
those things non-scale victories. Share with us
yeah.
some of you. Share with us some of your non-scale victories.
Non-scale victories. So, um, I think one of my biggest ones recently was I went on a trip for my work and I had to go on a flight. And the last time I went on a flight, like 8 years ago, I had to use the seatbelt extender. I didn't have to.
That's
And I was
great.
like, I almost cried on the airplane. And I was like, I can buckle and I can actually tighten it. Like it's not like at the end of its little line, like it's actually I can tighten it there and like tighten it a significant amount. And um another one is that, and it's kind of funny because going back to the seminar before even starting this process, one of the things that was also mentioned in there was that your mood is going to change and that you're just going to feel better like emotionally. And I never at the time when I was listening to that, I was like, "Oh, that doesn't really apply to me because I'm not like depressed. I'm not, I'm not unhappy with who I am or what I am." But it's there was this strange moment a few months ago when I kind of had this realization that I did feel better. Like I felt it's the only way that I can describe it is that I felt lighter and it wasn't just a weight thing. It was like I felt like mentally lighter. Like I felt like I could think better, like I was in a better mood more often. It was kind of this weird moment where I was just like, wow, this is weird. Like I feel really good. Like not just physically, but mentally. Like this is and it was kind of one of those things that I was like, okay, well, that makes sense now. Like that's why they said that. That's why they mentioned that. And um, that for me is another non-scale victory because it's like I am a happier person now. Even though I didn't feel unhappy before, I don't know, it's so hard to describe because it's kind of it's still new territory for me, I guess, with that because I'm just like, I don't know how else to describe it other than that I feel like lighter and more expressive and more like I'm enjoying myself more.
That's fantastic. That's great. Anything else about this journey that you want us to know?
Um, I think that it's important for you to be your own advocate. Like ask as many questions as you can. Again, do as much research as you can. Do It does take work. It's not again, it's not a magic button. We can't just, have the surgery and then expect the weight to fall off. We really need to uh, honestly, I do think that it's important to go to therapy at the very least before surgery. Get yourself in a good headspace to kind of get yourself in um in a place where you can make decisions that are going to be beneficial for you during and after this process. And to continue to make those decisions afterwards. I am almost a year out from my surgery, and there's days where I'm really good at following the diet, and there's days where I'm not. But I've learned not to beat myself up about those days where I'm not quite as good. Like, so that way I'm not like just, oh, I'm just gonna give up and like throw in the towel. Like I totally screwed up my diet. Like um, I think one thing that I'd like to share that my therapist had told me was that losing weight is like learning to ride a skateboard or a bike. The first few times you're going to fall off. You're going to skin your knee, you're going to skin your elbow. You're going to keep falling off until you learn to ride it. And then when you want to learn a new trick, you're going to hurt yourself a couple times. You're going to fall down. You're going to make mistakes, but then, and you're not going to nail it the first few times, but then you're going to nail it that one time. And then you're going to nail it again and then again and again. And so give yourself the grace to understand that you're going to have moments where you're not doing as good. And that's okay. Just don't let those be the last time. Don't let those be the end all. Like, you can do this, and you can stick to it, and you can be successful. I'm almost 30 pounds away from my goal weight at not quite a year. No, it'll
But
be
you're
a
close
year
to a
on the
year, right?
31st.
It's within, oh yeah,
Yeah, on the
31st. Yeah.
yep, yep, the 31st of this month. So, and when I had my 6-month checkup, they had expected me to lose, um, I think it was only like 60 something pounds. And at that point, I had already lost, like, from the day of surgery to my 6 months, I had lost 86 pounds. So it was like big, huge jump from where they had even anticipated me losing at that point. And it was funny because I was like, at that point, I hadn't even started any strength training or aggressive exercising yet. I was just doing my following the diet and tracking it in the Veritastic app as much as I could. And again, even with that, there's days where I'm not as good at tracking, but other days I'm good at tracking. And um, so just give yourself the grace to not be perfect.
Yeah, no, that's great advice, and I love the analogy that your therapist gave you of of skateboarding or riding a bike, and there's going to be bumps and bruises, but at the end you'll be skilled at it. That's great. Um,
Mhm.
how much have you lost? What's give us an idea of how that's been for you?
So since my surgery, I've lost 83 pounds. Before the surgery, I lost about, um, I think it was like 46 was the number that I had lost pre-surgery. And that was just working with what the dietitian had told me to do. And then, following what the advice of like the surgeon at my appointments and all of those things. So, um,
So if I do the math correctly, that's about 129 pounds since you started this journey.
yes.
That's
And,
fantastic.
in the last, like, 4 or 5 months, I have hit a couple of stalls where I've kind of, like, gone up and down a little bit on the scale, and that's a combination of either just, because I have started the strength training, I'm gaining muscle, and muscle is heavier than fat, so but I'm losing inches in that process, so I think that's another thing that's important for people to track in this process because 'cause you're gonna hit those
Absolutely.
stalls, and those stalls are they can be really devastating. Like, I feel it. Like, you're so used to seeing that weight coming off every week, but then all of a sudden you're stuck in like this little range that it just won't. And that's partly because where my body history doesn't like to let go of that weight, that's what it's doing is it's like it gets conditioned and used to what you're eating and what you're doing activity wise. So you kind of have to try and change a few things up to kind of trick your body and your metabolism into, okay, now we're losing weight again. Like, instead of like holding on to it, like, you have to start kind of changing up your routine a little bit.
And as you mentioned, I notice, or patients notice, and I try to point this out to them during that time period when the scale's not changing. You often will notice that inches are changing, clothes are fitting different,
Exactly. Yeah,
and so keeping track of those things as well is helpful.
it is. And, it's okay. Like, I had a really hard time. Like, I went a really long time before I actually bought any new clothes because I was like, oh, I'm going to lose more weight. I'll just keep wearing what I have. But at some point it was like, okay, I can't wear this stuff anymore. It's really loose on me. It's not fitting right. I don't really feel good in it because it's not helping me like celebrate what I'm doing. And it like, I'm not saying go on a shopping spree at your 4 or 6 month post-op mark, but buy yourself a couple of outfits to help you feel really good about yourself and celebrate because it is amazing how quickly those numbers change too.
Yeah.
I went from initially I was a size 26 pant Um, the first time that I bought myself a new pair of pants and a shirt, my pant size went down to a size 16. And then a couple months later, I was down to a 14, then a 12, and now I'm in a 10. And so it's like you notice those little things and you're kind of like, okay, even though that scale may not be changing a whole lot right now, something is working. And so it's okay to celebrate yourself and to celebrate those little victories. And again, that's kind of another non-scale victory is, going from that 26 to a 10. Like I now like can fit in one pant leg of what I used to wear. And it's like I didn't ever think that I would ever fit in a size 10 again. Like that's kind of where my mindset was. Like I hoped I would, but I didn't think that I would actually get there. And so that was a big victory too for me, was that I was able to get there.
That's fantastic. Well, Paige, this has been very enjoyable. My last question for you is, would you do this again? And what advice would you give to other people thinking about weight loss surgery?
100%. I am so grateful that I had this surgery. Um again, I was a skeptic before I ever said yes to doing the surgery. And I 100%, like I wish I had done it sooner. Um, Granted, I don't think that I was in the right headspace to do it sooner. So I really think that there is a lot of work other than just the dieting and exercising that you have to do to make sure that you are prepped and ready for surgery. Um, Even if it is just working with a dietitian or a personal coach or something to kind of help you change the way that you perceive food, perceive weight, perceive obesity. Um, I think it's just really important to do a lot of that prep work ahead of time and to really get yourself into a good headspace where you can finally say, I'm ready for this. Like you need to make sure that you're able, because you do need to commit to a certain diet. Like it is a lifestyle change. It's not, I don't even like to call it a diet. Even when my kids say, oh, when do you, like my 6-year-old asks
Mhm.
me all the time, when do you have to stop this diet? And I said, well, honey, it's really not a diet. Like this is how mommy has to eat now. This is how I need to take care of my body. And it's it is a change that you have to be willing to make. And again, you're not going to be perfect about it every day, and that's okay. Don't let those little slip ups be the thing that throws a wrench in your whole system. Like allow yourself that little bit of falling off with a bike and then get back on it and ride again. You're gonna be fine.
Oh, that's fantastic. Great advice. Well, Paige, it's been wonderful chatting with you. Thank you very much for joining us today.
Yeah, of course. Thank you for having me.
Thanks again to Paige Schanze for sharing her story with us. Congratulations to her on so many great accomplishments. She is actually a patient of one of my partners, Dr. Matt Baker. Little shout out to Dr. Baker. He is an excellent bariatric surgeon, did a fellowship in bariatric surgery, and has been doing it for years. And she's very happy, of course, with the results he's helped her achieve. Please take a moment to subscribe, rate, and review our podcast. It will help us reach more people with these amazing stories. I also have a YouTube channel where you can see this video, as well as several other videos about surgical weight loss, general surgery, and robotic surgery. Join us next time for another amazing story.